This doesn't appear right.
You're live.
All right. Hello, everyone. Okay, so today we have been fortunate enough to have some experts in the field that are directly dealing with some of the issues surrounding the coronavirus, also known as COVID-19. We are here today at my roof, Milwaukee, at the Youth Innovation Center. And we want to provide you all with some information about coronavirus, about what it is, some resources that you have available for you, and just things that you can do to prepare for this virus. Okay, we have with us today Ms. Sumaiyah Clark. She works with Milwaukee County Department of Health and Human Services, and she is the Enterprise Project Administrator. We also have with us Dr. Minhaj Husain. He is an infectious disease specialist. He is currently working with Advocate Aurora. Okay, so a doctor on the front lines of this coronavirus, who also specializes in infectious disease. All right, well, now we want to start with some questions for you, Dr. Husain. So, if you can tell us, what is the coronavirus?
Sure. Thank you, everybody. I'm glad to be here. It's a very important discussion, and I'm happy to shed some light on this very important situation. We're hearing about a lot of information on TV and social media, and about this global pandemic, and I know it has everybody very worried right now about what to expect and where the dust is going to settle. So let's start with some. We have a lot of things to cover, so let's start with some basic things. What is coronavirus? We know what viruses are. The cold, the flu. We know these things. Coronavirus is new. It's novel. It's a family. We've had coronaviruses in the past. I mean, they've usually been mild infections, but this is something new. It's a new mutant. It started out in the Far East in Wuhan, China, and the mutation probably occurred in animals, bats most likely, and somehow it jumped to humans. And since it jumped to humans, it has now found a way to jump from one human to the next, to the next, to the next, with globalization, travelers, returning travelers, contact with patients, etc. It's found a way to now spread within the community. And unfortunately, because it's a new virus and our immune systems have no idea what it is. Normally, when your immune system sees a virus, it recognizes it. In this scenario, our immune systems have never seen this before, and our immune system is being confused, and that's why it's in a way where I don't mean to sound ominous, but in a way we're sitting ducks. The virus is just jumping from one person to the other with very aggressive spreading.
All right. So, should I buy a mask? Is a mask even going to be effective as a way to kind of prevent me from getting the virus?
So our recommendations are evolving by the day. We may make some. The CDC is coming out with more and more information every day. We may make some recommendations today, which may or may not apply a month from now. As of now, the recommendation is if you are not sick, we are not recommending you to wear a mask in public. It's not necessarily going to stop the spread of the virus. Now, if you're sick, if you're coughing, if you have a high fever, you should probably be wearing a mask. But otherwise, just for people in general walking around, just no symptoms, I don't think a mask is going to do you much good. Okay. Unless you're a healthcare provider caring for a patient who is sick.
Okay. So I hear a lot about people self-quarantining. If I live with other people, how do I quarantine? Or just how do I quarantine, period?
So let's understand some definitions here. Stay at home is the first step. So we're talking about social distancing here. Stay at home is the first step, which means you have not been exposed, you have no symptoms, you're fine. You're just staying at home because that's the best way to limit the spread of the virus. That's step one. Step two, you have been exposed. You have come in contact with a person who has the infection, and you've had close contact with them. And now you're quarantining yourself. So first step was stay at home. Next step is quarantine. I don't have the infection, but I've been exposed, so I don't know yet. I have no symptoms. I may need to be tested. The quarantine is a duration of 14 days. How do we do that when we're at home? Well, if you're asymptomatic, you really don't need to sequester yourself off into a different corner of the room. You have no symptoms. Just keep an eye on yourself. If you start having symptoms, you may need to be tested. You need to talk to your doctor at that point. Once 14 days go by and you're doing fine, then your quarantine can end and you can go back to just staying at home. Third step is beyond quarantine is isolation. Isolation means you have diagnosed infection. You've been tested. You are positive. You're a confirmed case at this point. Now you're no longer in quarantine. Now you need to go into isolation. What that means is now you need to go into a separate room in your house, use a separate bathroom in your house, keep a mask on at all times, limit your interaction with the other people in your house until your symptoms resolve, until you have been tested negative by a doctor who says you can come out of isolation at this point in time.
All right, great answer. Well, when I'm out in public, I hear that I'm supposed to practice this social distancing. What is social distancing?
So some of the social distancing aspects is what we just said. Stay at home, quarantine yourself, isolate yourself based on the level of infection you have. The other thing is that we don't want too much crowding. The CDC recommended a few days ago that we don't want gatherings of more than 50 people in one place. Like a place like the Maruf Center, for example, we discourage gatherings of more than 50 people. Now, Wisconsin has actually made that into gatherings of 10 people. Public gatherings of 10 people are now highly discouraged. So that is social distancing because the virus basically within 6 feet of, if you're within 6 feet of another person and that person coughs or sneezes, they can potentially throw droplets that you can inhale and you will be infected. So social distancing is everybody trying to keep a little space to themselves, whether it's in your homes, if you're out in public, try to keep some distance from other people. Don't huddle too much, don't crowd too much, because that's what the virus really wants us to do right now.
Okay, all right. So what is the best way for me to interact with people if I have to go out?
If you have to, obviously, some people have to. Everybody doesn't have the choice of staying at home. I don't have the choice. I have to go to work every day. If you do have to go out in public, keep the social distancing aspect in mind. Keep the distance. No handshakes, elbow bumps, namaste, whatever you got to do. But no handshakes. Minimize the contact. No hugs. No social hugs. Minimize all kinds of contact. You're not being rude. You're not being disrespectful. You're just being minded. If anything, you're being more respectful. That's one. Two, try to wash your hands as much as you can. I can't stress this enough. Wash your hands. When you go out, if you're touching things, if you're touching objects, if you're touching your car, if you're touching anything, wash your hands. Keep a hand sanitizer with at least 60% alcohol with you at all times. Watch for if there's anyone who's sick in the gathering where you're at, recommend that they wear a mask, or better yet, ask them to, with all due respect, go home. So if you do need to go out, if you need to interact with people, do it, but just keep it, just mind these things, keep the distance, keep the spacing, keep the hand hygiene, keep all those things in mind.
All right. And if I can transition for a moment to some questions for you, Ms. Clark. Can you share some precautionary measures that the city is doing in general to protect its residents?
Sure. So Milwaukee County is composed of several municipalities. So Milwaukee City proper, as well as Wauwatosa, Franklin, West Dallas, the North Shore suburbs, and that sort of thing. And so one of the things that we're doing right now is just keeping open communication. And so with that open communication, we've established a website. We've established meetings and partnership with other leaders of various health departments. There's about 12 different health departments across Milwaukee County that we've been working with. We've also been working with healthcare providers, whether it be Milwaukee Healthcare Partnership, which is the hospital systems, and other community-based individuals as well. So one of the first things is just making sure that there's education and there's information. So the county has actually established multiple websites And you can even Google like Milwaukee County and COVID-19. With there, you're able to see like what are the closures and where are the spaces where we're still offering services, but where we may have made modifications or changed them to make sure that we're responding appropriately to make sure that we're really reducing the risk. So there's a lot of things that we've done so far. And again, those things are available on the website. One example would be making sure that people can still access the services that they need. For example, this is a time where we're doing energy assistance. So people can still go and apply for energy assistance, but we're asking that they're able to do that by the phone. And then we have two centers where they can just drop off the paperwork to verify the information that we covered over the during that phone intake. And that's really being established across. And so since we're talking about energy assistance, if there are individuals who are concerned about, having their homes heated, or even if they've lost heat, they can contact 414-270-4653 or www.keepwarmmilwaukee.org to get more information, just as an example.
Great. Okay, so back to you, Dr. Husain. If I think I may have been around someone who had symptoms of COVID-19, of coronavirus, what should I do?
If you're not sure they have the infection, the question is, are they a confirmed case or not? Right now, it seems like you're asking about somebody who's not a confirmed case, but you suspect they may have it. If in that scenario, you really don't need to do much different. You just need to keep an eye on yourself, watch for your symptoms, see if you're getting high fever, shortness of breath, confusion, things like that, and keep a close eye on your symptoms. If you really don't have any symptoms, you don't need to quarantine yourself. You don't need to do anything because you're not sure the person even had it. Now, if you later find out that person truly did have it, then you have to quarantine yourself, as we talked about earlier.
Okay. Is there anything that I can do myself to protect myself if I think that other people around me may have this?
Well, it comes down to social distancing. It comes down to limiting your contact with other people to whatever extent possible. You're still going to have your family at home and things. So you could just do those don't cough on anyone, don't sneeze on anyone. Basic personal hygiene. Right now, the bottom line is it's, and this is a global pandemic, which is evolving very rapidly. As recently as 10 days ago, it wasn't even called a pandemic. And, in a previous interview, somebody asked me, is it a pandemic? And I said, no, not at that point. So it's evolving rapidly. So really, what I need people to understand is we have to acknowledge that at some point, we are probably going to be exposed or infected. And so we need to be ready for that, and we need to know what to do, because a lot of people are going to be exposed to this. So if you have all you can do is make sure that when you are exposed or infected, give yourself the best chance of recovery. If you're a smoker, quit now, ASAP, no excuses. If you drink, quit now, ASAP, no excuses. If you have bad eating habits, fix them. Do everything you have to do to get your immune system, eat an apple a day, eat healthy, do what you have to do to get your immune system to the point where if you get it, you have the highest chance that you are going to survive it and make a full recovery.
All right, okay, thank you. So I hear that children are less likely, adults are more likely. Who really is at risk of getting this virus?
Every single person in the United States, all 340 million of us, are now at risk of getting this virus. That's the bottom line. I don't mean to sound to scare anyone, but this is the fact of the matter. Everyone is at risk of acquiring this infection. Who is at risk, if I may adjust your question a little bit to say, who is at risk of getting super sick from the virus? Now, those would be your elder people, above 60, 65 perhaps, people who have chronic lung conditions, chronic smokers, COPD, diabetics, dialysis patients, transplant patients. They can get a lot sicker. The children, like you said, fortunately, children for the most part, the mortality rate worldwide that we're seeing in children is minimal, probably next to zero. So fortunately, the virus, for unknown reasons, is sparing children for the most part, but we can't rely on any of that. Um, Also, fortunately, is that so far the mortality rate in general of this virus is very low, maybe 2 to 3%. Right now in the United States, we have about 7,000 cases, give or take, and I think there's about 100 or 200 deaths, something in that, or not that much, 100 and 120 deaths, something in that range. So we're really at about 2 to 3% mortality. So the majority of the people, 95, 98%, are expected to make a recovery. And most of them would have upper respiratory tract, mild symptoms. Some may be asymptomatic. Some may not know they even have it. Those are more dangerous because they're probably spreading it without knowing it. There's only going to be a few people who will have lower respiratory tract, pneumonia, respiratory failure, multi-organ failure, sepsis. These are going to be very sick. And these are the ones who will need ICU care, maybe a ventilator. And those are the ones we really need to be worried about because they're going to be impacted the most.
So if I work around or live around people that are more vulnerable in ways, like they do have comorbidities, they do have diseases, should I do anything different around them, around people that I live around or work with that do have pre-existing disease already?
So if you feel that your job, let's say you're in healthcare, let's say you're in any other field, that your job is exposing you to the potential of acquiring this infection, of being exposed, and you feel you may be bringing it home to these people who are susceptible, then you probably either need to move them into a safer environment, into a whole different living situation, into a different apartment, if that's financially and logistically feasible. If not, then at least move them into a separate part of the house for a little while until things boil over a little bit, at least for the next 8 weeks. The next 8 weeks is going to be crucial throughout the country because a lot of where we stand, are we going down the Italy route or are we going to be better off, will be determined over these next 2 months. So if that's the case, you really need to sequester them into a separate room, almost like they're quarantined, even though we don't know they've been exposed. So we need to be especially careful with them. Maybe even have them wear a mask when they're interacting with other members of the family who could potentially be bringing this virus home to them.
Okay, well, I have some questions from the audience here that I'm going to ask you here. So I have a person here that's asking, is this virus transmitted person to person, or is it transmitted on surfaces as well?
This virus is absolutely transmitted person to person, and that's the whole reason of all the social distancing, quarantining, isolation, etc. So there's no question about it. The majority of transmission is through respiratory droplets, coughing, sneezing, just even breathing. It's transmitted via the lungs into somebody else if you inhale it in. Surfaces, the virus, now data is still conflicting. Let's say you sneeze into your hands and then you immediately touch somebody else. You can potentially transmit it to that person for a short period of time. The exact duration, we don't know yet. Maybe a few hours, maybe longer. Let's say you sneeze onto an object, a table, a book, and then another person touches that. And then they touch their face. They could potentially be transmitting it to themselves. But as far as we do know, the virus becomes inactivated on surfaces at a much faster rate. So within a few hours, probably, even though the virus may be detectable, but it's probably not pathogenic anymore. Nonetheless, we want you to Clorox down anywhere you may have sneezed, coughed. We want you to wash your hands and keep the precautions up.
All right. I have another pretty good question here. Are there vitamins or supplements or anything that we can take to kind of prevent ourselves from getting it or strengthen our immune system or so?
So there's nothing you can take to prevent yourself from getting it, but you can take things to if you do get it, to prevent yourself from getting super sick. That's all we can do. If you're going to get it, you're going to get it. Of course, we're going to do everything we can to flatten the curve, as we say, as to make the acquisition slower. But sure, keep up with fruits, vegetables, and I said earlier, if you smoke, quit. Have healthy eating habits. Decrease your sugary intake. If you're a diabetic, get your diabetes under control, because you still have time. You may say, "Oh, I don't have time to get my diabetes under control." Sure, you do, because this is not going away in a drop of a hat. It's going to be with us for a few months. So eat healthy habits. These are the ways that if you do get it, hopefully you won't get as sick.
All right. And one more question. This concerning the vaccine. So, will a vaccine be available anytime soon? How long will it take for a vaccine to become available to the general public?
Great question. That's a $1 million question everybody wants to know. Vaccines, the way vaccines are made is we first have to assess the immune response of people. Okay, so we first have to see what is the virus doing, how is our antibodies responding, and then we assess those responses and we create serum and etc. And then we have to go through FDA approval. Long story short, it could take 18 months to 24 months before we have a vaccine. We are not anywhere close to a vaccine yet. I'm hoping if we're best case scenario, maybe within 12 months. I know a lot of people are starting to get to work on it. So it's possible it could happen sooner, but with our regulations, and we have to make sure it's safe. We can't give it and have people get sicker. It has to be safe. It has to be effective. It has to have all these things. And then we have to have public, the public in general has to be accepting. We have a vaccine for the flu, which half the people don't take because of all kinds of silly reasons. So all these things have to happen, and I don't think anywhere from a year and a half at a bare minimum.
Okay. So I also have another question for you, Ms. Clark. With school closures, where can families get food for their children? Or do you know of a list of resources where families can get provisions for their children?
Sure. So NPS, well, I guess I'll start by saying Governor Evers has closed all of the schools as of this Monday. Initially, that school closure was, I believe, listed until April 14th. But now we know recently that that's been extended to like an indefinite date. We're not quite sure when schools will reopen. But what NPS has done is, I believe from 11 a.m. until 1 p.m., Monday through Friday, they do have meals available. So children can go there and they can get meals. The other good thing about that is NPS has set up, during that time, families can go and get enrichment activities because now all of a sudden kids are there at home and, they're, could be missing out on instruction. So teachers are providing resources so that families can, keep their children on track academically.
Okay. What about food pantries? Are there more services for food available as well?
Absolutely. So there are some community centers that are still able to operate only because they're a food pantry. There's the Milwaukee Islamic Dawah Center that's located on Titonia and Villard that has a food pantry a few times a week. Bayview Community Center has food pantry that's available, I believe, from until 12:30 on days where there's, I believe, 10:30 to 12:30 or something like that, where families can drop in. For a complete list, since it is changing like daily, I would suggest people contact Impact 211. They do have, the most up-to-date list, so people would be able to call in and see where they can access food pantries that are closest to their homes. One modification that the city and county has been making regarding food pantries, oftentimes when you go in, you have to actually sign information and give information for counts. Those requirements have been waived. And there's other ways where you can go pick up a box and you go, no questions asked.
Okay. What about the service Meals on Wheels? Can you share any info about that service?
Sure. So Meals on Wheels is operated through the Department on Aging. It's a part of Milwaukee County. And seniors are continuing to receive meals. There's a list of senior dining sites that have all been transitioned to carry-out meals. And the carry-out meals, they can either be fresh, they can be frozen, or they can be comprised of like non-perishables. And so a list, it would be like Arlington Court, Clinton Road Senior Center, College Court, Covent Hill, Dolan Community Center, Elks Lodge, Fordwood Court, Franklin, Greater Galilee, let's see here, Hart Park Senior Center, Kelly Senior Center, Lapham Park. So there's all of these different senior dining sites are all transitioning to carry out. The Indian Council for the Elderly will also be transitioning to carry out meals beginning on the 19th. And then the Hunger Task Force will be using a drive-through method at senior centers so that the seniors won't actually have to go into the building. So again, we are still continuing to provide meals for the seniors.
All right, great. Those are a lot of resources there. Now, another question for you, Dr. Husain. What should I do if I have symptoms? And with that, can you also share what are the symptoms that we should look for?
Sure. So first thing you have to understand, just because there's a new player in town doesn't mean the usual suspects have gone to sleep. So the likelihood of symptoms is still higher with the cold. If you have some, so if you have a cold, what are your symptoms going to be? A little bit of congestion, a little runny nose, a little sore throat. Those are more likely to be the cold. So every sneeze and every sniffle is not coronavirus, is not COVID. If you have a high fever that with onset like that within literally a day, and you have generalized body aches, and you just feel like you can't move a muscle, you are so sick, that's probably the flu. So the flu is not subtle. The flu comes on rapidly, and the flu just knocks you out. You can't do a thing. If anyone here has had the flu, they know exactly what I'm talking about. COVID-19, which is the name of the disease, coronavirus, the name of the virus, is a little bit more subtle. So if you start developing symptoms, let's say, for example, you were exposed to somebody who you think may have had it, and over the next few days, usually about 5 or 6 days later, you'll start developing a little bit of fevers here and there, a few body aches here and there. It's a little bit more subtle. Your breathing isn't quite the same. You may get a little winded here and there, a little bit more. You won't so much have much of a sore throat. That's more for cold and flus. Sore throat is not as much. Nasal congestion, maybe not as much. So these are some of the symptoms. But the bottom line is it's going to be very hard for an average person to really distinguish whether they have a cold, flu, or COVID-19. That's why they're going to be very worried. So my advice would be, if they're minimal symptoms, which you can wait it out and see how you're doing, and you feel you're getting better, just wait it out at home. You don't have to necessarily go running to the hospital. But if your symptoms, if you're short of breath, if you can't catch your breath, you can't wait it out at home. You need to seek urgent medical care right away because you could potentially have the coronavirus.
All right. Okay. Earlier today, we discussed the virus potentially being on surfaces, on objects, but what about deliveries? If I'm ordering something from outside of the country, should I be concerned that there's a potential of me getting virus from that even?
Well, no. By the time it comes from another part of the world to your home, the virus is not going to survive that long. And even if it did, there's no pathogenic potential to that. Even if the product is, let's say, made in China or whatnot, there is almost zero likelihood that the virus is coming intact all the way from across the world straight to your home. That's very, very unlikely. So no, that's not. You can still get. I know the pizza deliveries and all these places are ramping up their hygiene processes and things. And from what I'm hearing, I can't vouch for this, to be honest with you. From what I'm hearing, that's safe as well.
Okay. And another question. If during this period I want to visit different family members, because I'm concerned, since everyone's out of work, I'm concerned that someone may not be receiving the care that they need. How do I interact with my loved ones? Should I still visit them? Is that still an option? Or what do you think?
So that's a very good question. One thing we have to understand, just because we're staying at home, quarantining ourselves, it doesn't mean that other people are not, that it doesn't mean that we cannot interact. You can still call them. You can FaceTime them, which would be my recommendation before you go visit them. I would call them. I would FaceTime with them. I would see how they're doing. Are they doing okay? And if that's all you need, then maybe that's all you need. Now, if you really do need to visit them and check in on them, then make sure they're not sick, because you could potentially make yourself sick. So first call them, talk to them, ask them how they're doing. Do they need any supplies? Do they need any help? And make sure they're not sick. If they're not, and if you would like to go visit them, please do, but take all the precautions. As soon as you walk through the door, sanitize your hands. When you're leaving the house, sanitize again. Social distancing, sit at a bit of a distance from everybody. Keep all those things in mind.
All right. So can you share whether or not people always get severe disease, how likely it is for someone to get a severe disease, and the likelihood of someone surviving the coronavirus?
Most people will not get severe diseases. That's right now, so far, that's our hope, and that's what the data is suggesting, that majority of people, I would say the range of 80% people will not have severe diseases. It'll almost just feel like a really bad cold or maybe a little flu-like symptoms, and then you'll be fine. And maybe a week or 10 days, you'll get better. But there are some people that we talked about before, bad diabetes, dialysis patients, chronic lung disease, heavy smokers. They will probably get more severe disease. So, and those will be probably the 15, 20%. And I can't say that for sure. Even young, healthy adults, like we had in Italy, we saw some people who were 40 years old, 35 years old, who were getting severe disease. So I can't say that for sure, but these are what the statistics are showing. Now, the mortality, if you're young and otherwise healthy, your mortality should be less than 2%, which means there's a 98% chance that you will survive this episode, okay? If you have some of these chronic conditions, then unfortunately, your mortality has now gone up to maybe 20 to 30%. And you will likely need to be hospitalized. You may even need ventilator, ICU care, because the infection, as long as it stays in your upper respiratory tract, you're probably going to be okay. If it descends down into your lower respiratory tract, which is what we call a pneumonia, basically, then your chance of getting a severe illness and your chance of mortality goes up exponentially. So to answer your question, the general population should be expected to hopefully survive an infection. But it's going to be certain pockets of people who have chronic conditions, elderly, chronic conditions, their mortality is going to be high if they get the infection.
Okay. So concerning the treatment for coronavirus, we know that for bacteria, there's antibacterials, but for this, what treatment really is there?
There is no treatment for coronavirus right now, unfortunately. There's no FDA-approved treatment. Viruses do not, you're absolutely right, viruses do not respond to antibiotics for that. That's for bacteria. Trials are being run on certain HIV drugs that they may have some activity against them. There's another drug called remdesivir, which has shown some benefit only in the severely ill patients. So whatever treatment you have that we are offering patients is for the severely ill. Hydroxychloroquine is another drug that we use for people who have rheumatoid arthritis and things like that. So that has shown some benefit only in those who, like I said, out of the people who get it, 80% have mild to moderate illness, but those 15 to 20% that have severe illness, these drugs are being used on an experimental basis in them, and they're showing possibly some benefit. I need to stress the experimental basis aspect of it because there is no FDA-approved drug right now for coronavirus. It's basically supportive care and hoping your body's immunity will eventually fight it off.
Okay. So I have a question for you, Ms. Clark. If I have symptoms and I'm concerned and I want to do something about it, but I don't have insurance, what resources are available for me, or what should I do at that point?
Yeah, that's a very good question. So we don't currently have testing centers set up right now in Milwaukee County. The federal government right now is working to give us the testing supplies and materials so that we can establish those testing centers. And once we have them, we will be making that information available to the public. So what we are asking individuals to do, following Dr. Husain's recommendations, are, to reach out to, like, if you have a doctor, if you're wherever you're accessing your health care, we ask that you call them in advance so that if you have these symptoms, you're not just sitting in the waiting room with the potential of, exposing other people. So if you can call them first and then, go to your provider or the healthcare center where you normally receive care. There is some conversation about, being able to get testing without payment and then even getting treatment without payment, but those details have not been solidified at this point.
Okay. So another question.
Can I add one word to the testing aspect of it? Right now, testing is very limited. We don't have the full resources, as Ms. Clark pointed out. Yesterday, for example, the state has about the capacity to run 400 tests a day. Yesterday, they received 1,000 samples. So we are far behind in our capacity to do testing. And so that's why we're trying to triage who really needs the test. And that's very important. What she said is if you have mild symptoms, call your doctor first and see if you maybe need a test, and you can be, watch yourself at home before you come requesting a test.
Okay. And this next question also may be directed towards both of you. If someone is basically has to take the bus to work, or has to take some form of public transportation, should they be concerned in that case?
Yes, because I know people need to take the bus. They don't have an option at times, but I mean, I can't say that they're not at some degree of risk by they're in a public place. It's a gathering of more than 10 people. As we said, we don't want gatherings of more than 10 people in the state. There's definitely a possibility that buses can be crowded sometimes. Some people may be coughing. And we have a problem of presenteeism in this country because, we don't have a lot of PTO and some people have to go to work. So even though they're coughing, they will still go to work. So if you are taking the bus, you are risking something. So in that particular scenario, I would recommend that if you yourself have any symptoms, wear a mask. And if you don't, if you feel that you don't know what to expect on a bus in a crowded setting, possibly wear a mask there too, even though you're asymptomatic. I wouldn't normally recommend that, but in that particular scenario where you're in a crowded setting for a short period of time with I don't know how good the circulation, et cetera, is, it's probably better to protect yourself.
Okay.
And I'd like to add to that actually, because working with Milwaukee County, the Milwaukee County Transit System has put together like a list of precautions to make it safer for not only the drivers, but also the passengers who would be riding. So there's a few things that they've done. They've implemented an extra daily disinfection process. They're already, trying to make sure that the buses are clean, but they've added additional steps, making sure that even the cleaners that they're using are CDC recommended to make sure that, any viruses or that sort of thing would be killed. Another thing that they're doing is they're asking that if people are traveling out of necessity, if you're feeling sick, we just ask that you don't take the bus, taking into the considerations that Dr. Husain said, people oftentimes are, in a position where they need to take the bus. But if you're sick, we are asking that you do stay home and you do that self-quarantine. Another thing that we're asking is once you're on board, we're asking passengers to leave extra space between themselves. So, if at all possible, don't sit right next to a person. When we talk about social distancing, normally we try to say that you should stay about 6 feet away from another person. And then lastly, we're asking that when you arrive at your destination to exit through the rear doors, normally there's the doors in the front right by the driver, and then there's a second set of doors in the back. So we're asking that you exit at the back. And if you do need to talk to the driver, there's yellow lines. So if you can stand behind those yellow lines when you're speaking to the driver so that you have that distance, and then it's safe for all parties involved.
Okay. I have another question for you.
Sure.
With the announcement of this global pandemic, a lot of people are experiencing a lot of anxiety
Absolutely.
over this virus.
Mhm.
What are resources for people that are experiencing a lot of anxiety and stress due to social distancing and just in general?
Sure. So I'm gonna start with something just maybe out of like a selfish thing because I'm a parent. And so now I actually have the ability to work from home, but I have children at home while I'm teleworking and that kind of thing. And then, I have a teenager who's, a little antsy and Fortnite is maybe not keeping his attention as much. So it can be stressful as a parent, to now deal with, all of the other challenges that you have and then to balance. And so there are some resources available to parents. One of those resources is offered through the Parenting Network, and they actually have a parenting helpline. That is the phone number to access that parenting helpline is 414-671-0566. The nice thing about that is that they have experienced phone counselors who are able to respond to parents. Like if I just need to talk to an adult, my teenager is, acting some sort of way, or we're just, kind of tired of being cooped up in the house and everyone is kind of feeling, anxious, you can contact them to get support. Milwaukee County also has a 24-hour crisis line. So if I just need to talk to somebody or maybe get some additional resources or support, there are counselors that are available, again, 24 hours. You can contact the Milwaukee County 24-hour crisis line. That number is 414-257-7222. And then you can also call Impact 211. At both of those numbers, there are clinicians or resource coordinators that are available, and they can connect you to resources. I do know that I've been sharing a lot of phone numbers. This information is available on the county's website. We'll make it available through Maruf, and as we continue to update resources, we'll be making sure that we're providing updated information as well.
And Dr. Husain, if you can answer also, when does this coronavirus become fatal, and why really does it become fatal for some people?
We don't exactly know who it's going to. So we talked about earlier, there are some groups that are at higher risk. Elder people, people with chronic conditions, lung conditions, diabetes. These people are going to react much worse to it because their natural immunity is much lower than probably a young, healthy adults would be. And in them, the mortality, unlike the general population, which is 1% to 2%, in those people, the mortality is 20% to 30% potentially. So in them, it could potentially be fatal. Having said that, we don't know who is really going to be spared. I mean, we've had, like I said, cases in Europe who are 30, 40 years old and who we have mortality. So the odds are that most people will recover, but the mortality, the fatality, will still be there in about 1% to 2% people, which goes up to 20% to 30% if you have these chronic health conditions. And especially if the virus goes from your upper respiratory tract and it descends unobstructed into your lower respiratory tract, then it could potentially be fatal.
Okay. What are the chances of me surviving this coronavirus if I'm just a normal person, I don't have all of these pre-existing medical conditions and diseases? What's the likelihood that I'll survive, that I'll make it through?
Your chances are very good. The likelihood of you having a mild to moderate illness is about 80%. And if you have a mild to moderate illness, you'll probably be down for a few days, you'll have a bad cold, and then you'll recover. So for a young, healthy adult, if everything is in their favor, like I said, some people will still succumb to it. But otherwise, I would imagine for a young, healthy adult, there should be a chance of above 95% chance that you will survive without any problem. Some will unfortunately survive with a little hit to their lungs. And so they may have some respiratory problems lifelong. Those are, again, few and far between. But in general, a young, healthy adult should make it just fine. There's a bunch of NBA basketball players who are right now out with COVID-19. Kevin Durant just announced that he has it. So it would be interesting to see how these young, these are athletes at the top of their health, they're as healthy as they come. I'd be interested to see how they're going to make it. And from what I'm hearing, they're all doing well. And so not all of us have that health level. I understand that, but in general, a young, healthy adult should survive and recover without any problem.
Okay, and for the start, lastly, just to make sure that we've covered all of the resources that are already out there and available to people. If I'm looking for just normal essential things, even like going to the grocery store, it's hard to find just toilet paper. Like, what are things that I can utilize just to find just common things?
Well, some of the things, so again, I would recommend that people contact Impact 211. We've heard about things like needing baby formula or things like that. So there are different organizations that have a variety of resources available. But again, that's a really good repository where people can, there are resource navigators that can hear the needs and then get people connected to the appropriate spaces so they can have those needs met. Some other resources that might be helpful to children, teens, or adults. And then really going back to the question that you had around the anxiety that young people might be experiencing. We are working with, there was actually a meeting today with about maybe 50 or so youth development organizations and youth serving organizations. And so there's a lot of work that's being done right now to make sure that young people have more support related to recreation and youth development. We want to make sure, again, that parents have resources and support. We want to make sure that people are at risk of domestic violence or sexual assault, child abuse, that they all have supports as well, under these close spaces. So we'll make sure that there's a list for those sorts of resources available. The other thing would be like if we think about teens and mental and behavioral health needs, Milwaukee County does, and we are expanding the process to be able to move to telehealth and phone counseling. So like maybe I can't sit in front of my clinician, but if I already have a clinician, then, we're making sure that, those young people can get connected by the phone or by video conferencing. If there's a young person who has not, had challenges before, and, maybe someone is concerned about their health needs, then you can actually call the Children's Mobile Crisis Line, and that line is 414-257-7621. And through there are also clinicians that will be available to get that family connected. So there's a wide variety of services, whether it be tangible things that you need just to survive, getting food, making sure that there's, recreational types of support, and then even, all the way to crisis support. So again, we'll be sharing this information. And I do want to offer the county's website. The county does have a website. It's as simple as Googling Milwaukee County COVID-19, and all of that information is listed there, and it's updated daily.
All right, great. That's good. Yeah, one more question that was posted here, and I think this is more directed towards you, Dr. Husain. If I work in healthcare and I have elderly patients that I'm providing care for, should I be social distancing in that case, and how can I do that if I actually have to provide direct care to them?
Well, I work in healthcare and I provide care to elder patients every day. So, I before I answer that question, I just want to shout out to all my colleagues, nurses aides, pharmacists, doctors, who, while everybody is socially distancing and isolating themselves at home and staying at home, we just say, well, I'll see you tomorrow and we'll be right back the next day. We don't have that. Unfortunately, we don't have that option. And everybody is, risking themselves and going out every day to do what's best for our patients, trying to treat our patients, get them better. So big shout out to all of them. Keep doing what you're doing. You are the reason that we're going to beat this. So if you're in healthcare and you need to go do your job, but make sure you do with all the right precautions. Now, if you need to take a history from a patient, sit about 6 feet away, 7 feet away. If you feel they're symptomatic, they're coughing, they're sneezing, wear a mask in their room. You have to. So in our hospital, everybody who's a suspect, who is a PUI, person under investigation, who's suspected to have COVID-19, we're putting them under airborne isolation. And so if we have the rooms available. Now, if we don't have the rooms available, unfortunately, airborne isolation rooms are limited. We are putting them under droplet isolation, and we're wearing goggles, a mask. Doesn't have to always be an N95. It could just be a regular respiratory mask, and gowns and gloves. These are our personal protective equipment that we are advising for patients who are suspected until the tests come back negative. But if they're not a suspected case, if they're just any other regular patient. I mean, we have majority of our patients are not under suspicion for having COVID. You just treat them the way you would. You do standard precautions. You wear gloves where you can. You gel in, gel out. You do everything with this with all the same precautions because the life has to go on. Patients still need care. I mean, we still need to keep treating them. If you are sick, don't go to work. Please don't go to work. If you're sick, even if it's just a cold, take 2 days off. Take 4 days off. Don't go to work. Right now, it's too volatile situation. Our patients are frail. So these are the things I can advise them. If they're touching things at work, don't touch their face. These simple things that every day, that's what you got to do to get through this. Don't huddle too much. Don't hang out too much in the lounges and the cafeterias, etc. Keep social distancing, keep the norms, and hopefully we'll get through this.
Okay, and a follow-up to that question. If I work in healthcare and I'm concerned about bringing this virus back home to my family there, to my children and even my parents that may live with me, how do I prevent myself from bringing this virus back home?
By taking all the precautions that we just talked about, by keeping a close eye on yourself. If you start developing any kinds of symptoms, then you want to wear a mask immediately, the first sign of a symptom. Some of us now, I don't necessarily recommend this, but some people are wearing scrubs to work, and then as soon as they come home, they take those scrubs out and wash them right away every single day. That's one option instead of wearing regular clothes. That's one thought. And again, keep the same social distancing in mind when you're at work. Keep an eye on your symptoms and just go from there. I mean, there's only so much you can do. I mean, you cannot move into a separate apartment. It's not feasible financially, logistically for most people. You just have to keep doing what you're doing. Try to leave your dirty shoes outside the house. As soon as you come home, wash your hands immediately before you interact with your children. Change your clothes, wash your hands, take a shower if you have to, as soon as you come home, and then interact with your family. And those are the little steps we have to take and hope for the best.
I just want to add something because I know we've spoken a lot about social distancing. Earlier today, I heard someone say that social distancing does not equal social disconnection. And so I want to really drive home the fact that, yes, we need to be safe and have precautions, but we do not want to, isolate ourselves to the point where we feel alone or, because then there are all kinds of other challenges that can occur from that social isolation. So, make sure that you're still connecting with your social network, whether it be, like online or, through a phone call or that kind of thing, like reach out to others, look for support systems. There's a lot of things that are popping up online. There's dance classes that are popping up online. There's all kinds of resources. So I'd really like to, just drive home the fact that we still need to stay connected as much as possible, but just do so in a safe way.
All right, so thank you much.
I just want to add one point to that, if I may, if we have time, and I fully agree with that. I just want to advise people that be careful of what you read on social media. Be careful of your sources. Nowadays, everybody who has a Facebook account somehow thinks they're an expert. I want you to be very wary about what information you're getting because there's a lot of pandemoniums, a lot of hysteria. Try to go to the cdc.gov where you will get the most up-to-date and the correct information. Talk to your healthcare provider. Talk to the authentic resources. And again, everything we're saying today could evolve into something else in 2 weeks. It's a moving target. Everything is changing every day. Our knowledge is changing. So just make sure you're getting your knowledge from the right resources so we're not creating a hysteria. We will get through this as a community if we stay strong, if we stay united, distanced, but not disconnected. If we stay united, hopefully we will get through this coronavirus within the next few months.
Okay. Well, thank you. Thank you, Dr. Husain.
Pleasure.
And thank you, Ms. Clark. We hope that we've provided you with a lot of great resources and information concerning coronavirus. We would like to thank our two panelists, the project administrator of the Department of Health and Human Services, Ms. Sumaiyah Clark, and Dr. Husain, an infectious disease physician currently working with Advocate for Roma. Okay, we are at time now, and thank you all for participating.
All right, good stuff. And then wrapping up quickly, definitely appreciate all of you. Social distancing. Yes, we still are. I am Nadir Al-Mujahid, one of the directors here at the Maru Center. I do want to let you know we're excited and happy to be able to bring you this. One of the things I got just from viewing it, one is be calm. Basically, you may catch a cold and recover if you're otherwise good health. So no need to go ahead and panic. But for some of the resources that Ms. Clark spoke about, if you go to marufcenter.com, join our email list, we will be updating you with that and also giving you some notes in case you're not catching this live with us, which we understand, time may not be on your side right now. You may be working or in transit, but we want to make sure we got this information out to you, brought it to the community from an infectious disease expert in the field with Dr. Minhaj Husain and people who work in the county who really care about your health. And when it comes to our children, of course, this is our Maru Center. This is usually bustling with children and noise and playfulness and happiness. And, it hurts to really not have that right now at the time. But there are always other alternatives. We're not called a youth center for innovation for nothing. So with that being said, we're in the process of coordinating different online courses, whether it be the different chess, playing that virtually or meeting with mentors with our youth staff, because we're still coming in, we're still serving the community the best ways we can. If you got children at home and there are resources, even whether it's Spectrum, whether it's different food stuff, whether it's other bills, there are resources. Make sure you're plugged in with us, marucenter.com. Subscribe to our email list. We'll send you out a PDF, a follow-up of this, and also send you the links and logins and everything else you would need to connect your child to make sure they're not disconnected during this time of social distancing. So with that, we appreciate all of you. Make sure you act on some of the steps, share this video, subscribe to our page, really empower other people. Just know, worst case scenario, if you're good health, you might get a cold. Just like 100 years ago, there was no vaccine, other stuff, and flu, so you might get a cold. I'm glad to hear that because it's just so fatalistic thinking. And as the doctor mentioned, a lot of stuff is on social media that's not real. We want to bring you the truth for someone who's in the field. So again, thank you very much for participating. Remember, a wish changes nothing, but a decision changes everything. Assalamu alaikum. Peace.